What's your impression on Wuhan? A bowl of cold dry noodles. The rain of cherry blossoms. The ancient yellow crane tower. It's a major city in central China. A well-connected city links to domestic transports and international airlines. It's a megacity with 11 million people. It's now a city attracting worldwide attention. The city was first hit by the coronavirus outbreak. It's a strong city, overcame all the difficulties, and is now entering a reset mode. On December 8, 2019, a patient from Huanan Seafood Market was admitted to the hospital because of fever, cough, and dyspnea that lasted 7 days. 5 days later, his wife, who had not been to the seafood market, was also admitted to the hospital for pneumonia of unknown reasons. On January 1, 2020, Huanan Seafood Market was closed. However, the virus was already on the move. On January 2nd, 41 patients with coronavirus were diagnosed. Then the cases dramatically increased. China went through a tough crisis. Until now, this pandemic has affected more than 200 nations and resulted in over 3.3 million cases. One thing to be clear, Wuhan was believed to be the ground zero of COVID-19 outbreak, but Chinese and American and other country scientists are right now still actively working on identifying the origins and paths. Meanwhile, please stop with the speculations and political conspiracies. So this video is for those who somehow still don't understand how China got the virus outbreak under control. On January 23rd, 2 days before the Chinese New Year, Wuhan went into lockdown. All the public transportations across the city, including buses, subways, ferries, and trains, airports, had been suspended. Several days later, many cities across China shut down. It was on the occasion of the Lunar New Year, the Chinese government made an early decision to close Wuhan under great pressure. As always, we put people's safety and health at highest priority. First and foremost, our government quickly responded to this crisis and took decisive measures. On January 21st, the government promised that all the tests and medical expenses that everyone incurred during hospitalization would be covered by the Chinese government. As of April 6th, the per capita medical expenses of COVID-19 patients reached about 21,000 yuan. The cost for critically ill patients exceeded 150,000 yuan. The diagnosed and suspected patients involved a total cost of about 1.4 billion yuan, and medical insurance already paid 990 million yuan, and the final medical cost is still calculating. Since the city's health system was buckling under the strain, we didn't have enough beds and hospitals to take care of those infected. On the second day of the lockdown, the government decided to build 2 special hospitals. The first emergency hospital, Shan Hospital, with 1,000 beds, was delivered from scratch within 10 days and started the first admission of the patients on February 4. On February 8, the second Shan Hospital, with 1,600 beds, was also delivered. Statistics show that Shan Hospital had been operating for 71 days, with a total of 3,059 patients admitted and 2,961 cured and discharged, with a cure rate of 96.8%. Shan Hospital had been operating for 67 days. A total of 2,011 patients were admitted, including more than 1,000 critically ill patients and more than 1,900 were cured and discharged, with a cure rate of about 95%. By the third week of the lockdown, over 10,000 cases were confirmed and tens of thousands more were suspected in Wuhan. Since many confirmed cases with mild symptoms were still out in the community, they needed to be separated to avoid cross-infections. The government then decided to convert public buildings such as stadiums and convention centers into temporary hospitals. These hospitals accepted patients with mild symptoms who had been diagnosed but had not been isolated and treated. Patients admitted can basically take care of themselves. From the completion of the first 3 hospitals on February 5 to the closure of the last 2 on March 10, during these 35 days, a total of 16 temporary hospitals was built and more than 12,000 patients admitted. We can never forget that more than 42,000 medical professionals from 346 medical teams across China were drafted to aid Wuhan. They rushed to the epicenter by air, by land, together with the local 110,000 medical workers in Wuhan. They casted a white shade against this epidemic. It was definitely an unbreakable line of defense. The first aid team was mobilized on the New Year's Eve, a night for family reunions. It was heartbreaking to see the separating scenes because this deadly virus could mean a one-way trip for some of them. Yet they still put their country first and family behind. Since then, whole country was lifted. More and more doctors and nurses put their lives at risk on the battlefield. We have our young nurse in her 20s wiping away tears and gearing up. We have our respected professional in his 80s fighting on the front line and serving his country. Our military can also be counted on during this most difficult time. They stepped up and took over 2 busiest hospitals with the heaviest tasks. We witnessed how brave they are. We can't express how grateful we are. By the time of April 2nd, the Chinese government had supplied a total of 29,000 sets of ventilators, allocated more than 8 million pieces of medical suits, 1.65 million pieces of masks, providing strong support for epidemic prevention and control in Wuhan and even the whole country. We admitted the initial chaotic time in Wuhan, but we all are fighters. We all pull together as one nation. Starting on January 21st, China released a primary response to major public health emergencies before any province had less than 100 cases. The entire country was completely shut down. Everyone is required to stay home and washing hands frequently. Wearing masks is mandatory, not optional when going out. Only residents with medical emergencies or those with jobs related to fighting the epidemic are allowed to leave. Groceries were purchased online, left at the entrance, and picked up later to avoid contact. Once every 2 or 3 days, only one family member was allowed to go out. Another important measurement to monitor and trace the patients is that all cities have rolled out the Green Health QR Code app. Every Chinese citizen has it on their mobile devices. Everybody needs to show the health code wherever he or she goes, like the local community, the groceries, or the transportation hubs. On entering, body temperature is required to be taken and QR code needed to be scanned. Only green can be passed. Yellow or red code means home quarantine for 7 or 14 days. This health code is generated by the real personal data. It's easy to backtrace the close contacts or dates and places if he or she later develops symptoms. All of these measures have become daily routines for almost every Chinese. During community closures, some citizens stepped up to be volunteers. There were too many touching stories. Some helped residents buy daily necessities. Some helped pick up medical stuff to work. Some delivered food for policemen. Some worked for free at mask factories. Some stayed at home to cheer people up. Gloves and protective suits donated from across China and even from overseas. Lots of Chinese enterprises donated money, protective gears, and even helped build the hospitals. Yes, the whole society was doing all efforts to help Wuhan get through this nightmare. With a tremendous amount of courage, determination, responsibility, and cohesion, we finally came to the ending. Winter eventually passed and the spring has come. On April 8, after 76 days, Wuhan lifted its lockdown. On April 15, Guoshan and the Leishanshan hospitals were closed. And on the same day, the last medical aid team left Wuhan. On April 19, Wuhan had no new case report for the first time since the outbreak. Wuhan reopening brings hope to the world. We are more dependent on each other than ever before. History is always created by the brave, and nothing but unity and responsibility is the right theme of fighting against the COVID-19 pandemic.